Many older adults believe that exercise is the key to maintaining health and flexibility. However, some exercises that seem harmless may actually pose risks if not performed correctly, especially for those over 60 when the musculoskeletal and nervous systems begin to weaken. This video will warn you about 5 common exercises that can cause leg numbness, nerve damage, and impaired balance, thereby increasing the risk of falls and loss of motor control incidents that can have serious consequences in old age. Warning for seniors, stationary bike, safe or deceptive. The stationary bike, especially the recumbent bike, has long been considered a safe, low-impact exercise suitable for older adults. With its reclining posture, it puts less pressure on the knees and hips, leading many to believe it's the perfect choice for staying active in later years. However, few are aware that using a recumbent bike for extended periods or incorrectly can pose serious health risks, particularly for those over 60 risk of sciatic nerve compression. When using a recumbent bike, body weight is concentrated on the hips and lower back areas through which the sciatic nerve passes. If the seat is not properly adjusted or if one remains in the same position for too long, the sciatic nerve can be compressed, leading to numbness, burning sensations and pain radiating from the lower back down to the leg. For older adults, this is not just a temporary discomfort, but a warning sign of long-term nerve damage. Leg numbness and poor circulation. Sitting on the recumbent bike for extended periods can also reduce blood circulation to the legs, especially in those with diabetes, low blood pressure, or peripheral vascular disease. Insufficient blood flow can cause the legs to feel cold, numb, weak, and slow to react when moving. If this condition persists, it can lead to a loss of sensation in the feet, making it harder to detect obstacles or maintain balance while walking, thus increasing the risk of falls. Not everyone is suitable. Many people mistakenly believe that the recumbent bike is completely safe because it doesn't exert much pressure on the joints. However, this is only true when the user maintains proper posture exercises for a suitable duration and is advised by a professional. In particular, individuals with a history of sciatica circulation disorders or those who have suffered lower limb paralysis should be cautious when using a recumbent bike and may need to avoid it entirely if they have prior nerve damage. Tips for those over 60. Limit recumbent bike sessions to 20 minutes per session if you're not accustomed to it. Choose a seat with soft padding and a proper position to avoid nerve compression. Alternate with lighter exercises like walking, tai chi, or yoga. If you experience leg numbness, sharp pain, or loss of sensation, stop exercising immediately and consult a doctor. Exercise is beneficial, but it must be done correctly and appropriately for your physical condition. For older adults, an exercise that seems gentle can become a threat if not understood and used properly. Be a smart exerciser, not just for health, but for safety as well. Risks of the toe touch exercise. Be careful for those over 60. Toe touches or forward bends are basic stretching exercises commonly found in many workouts. Yoga routines or morning stretches. For younger people, this exercise helps stretch the lower back muscles, improve flexibility, and increase circulation. However, for older adults, particularly those over 60, this can be a double-edged sword if not performed correctly. Seemingly gentle, but can compress the lumbar nerve. Over time, the spine and intervertebral discs in the lumbar region deteriorate, lose elasticity, and become more vulnerable to injury. When bending deeply to touch the toes, all the pressure is placed on the lumbar vertebrae, L4, L5, S1 areas that contain important nerve roots. If the bend is too deep sudden or if proper warm-up is not done, the lumbar nerves can be compressed, leading to discomfort such as sharp pain, tingling, or a sensation like an electric shock radiating down the legs. Subtle leg numbness and loss of sensation. Like walking on cotton. Many older adults experience mild numbness, loss of sensation in the soles of the feet, or unsteady walking after performing the toe touch exercise for some time. This is a typical sign of nerve conduction disorders due to prolonged compression. What makes it more dangerous is that this condition often progresses silently without acute pain, making it easy to overlook until the damage becomes severe. Risk of permanent nerve damage with long-term, incorrect technique. Incorrect postures, such as bending the back too much, not keeping the back straight, or forcing the body beyond its limits, can cause the vertebrae to shift, leading to disc herniation and prolonged nerve root compression. In older adults, nerve recovery is slow and may not fully heal, which can lead to reduced motor control, weak legs, and increased risk of falls and loss of independence. Advice for older adults when stretching the body. Avoid deep bending if you have issues with your lumbar spine sciatica or leg numbness. You can substitute with gentler stretching exercises, such as extending the leg on a chair and bending the upper body gently with a straight back. Always warm up thoroughly before exercising and stay within comfortable limits, avoiding pushing your body too far forward. If you experience numbness, pain, or pins and needles in the legs after exercising, stop immediately and consult a doctor. Since the toe touch exercise, although familiar, is not a safe option for all ages, for older adults, caution in every movement is the key to maintaining health and preventing injury. Ifrinactumam, high-intensity aerobics and jumping movements. When health exercises become a risk for older adults. Jumping in place. Jumping jacks or high-intensity aerobics exercises have long been regarded as great ways to improve cardiovascular health and maintain a slim physique. However, for those over 60, these movements are not just to exercise, they also carry the risk of serious injuries and nerve damage. Impact forces place. Pressure on the feet, knees, and spine. Every jump, even a gentle one in place, creates significant force on the feet and knee joints. For older adults, as bone density decreases, joint cartilage wears away over time, and the body's elasticity declines. These forces are no longer absorbed effectively, but are transmitted directly to the joints and nerves. The spine, particularly the lower back, also bears pressure every time the feet land. This can increase the risk of degeneration, herniated discs, and nerve compression, especially when exercising on hard surfaces or without proper footwear. Exacerbating leg numbness and peripheral nerve damage. One of the silent but dangerous consequences of high-impact movements is the gradual wear and tear on the nerves, especially for those with existing peripheral neuropathy, commonly seen in individuals with diabetes or long-term circulation disorders. The tingling pins and needles sensation in the soles of the feet after exercising may not just be muscle fatigue, but a warning sign of nerve damage progressing. Overexerting or incorrect technique will worsen this condition from loss of sensation in the feet, lack of reflexes while walking, to increased risk of falls due to loss of balance. The hidden risks of exercise for seniors. Over 60 toe touches, high-impact aerobics and balance poses. Toe touches, a potential danger for those over 60. Toe touches, also known as forward bends, are a common stretching exercise in many workout routines, yoga classes, and morning fitness regimens. For younger individuals, this movement helps stretch the lower back muscles, improves flexibility, and boosts circulation. However, for seniors, especially those over 60, it can be a double-edged sword if done incorrectly. Seemingly harmless, but may compress the lower back nerves. As we age, the spine and discs in the lumbar region gradually degenerate, losing their elasticity and becoming more vulnerable to injury. When bending deeply to touch the toes, all the pressure is placed on the lumbar vertebrae, L4, L5, S1, which house critical nerve roots. Bending too deeply, too suddenly, or without proper warm-up can compress these nerves, leading to uncomfortable symptoms like sharp pain, tingling, or a sensation of electric shock radiating down the legs. Silent foot numbness and a sensation of walking on cotton. Many seniors experience mild numbness, a loss of sensation in the soles of their feet, or unsteady walking after performing this movement for a while, feeling as if their legs are soft like cotton. This is a typical sign of nerve conduction disorders caused by prolonged compression. What makes it more dangerous is that this condition often develops gradually and silently without acute pain, which may lead to severe damage before it's noticed. Permanent nerve damage if performed incorrectly over time. Incorrect posture, such as excessive bending of the back, not keeping the back straight, or forcing the body beyond its limits, can cause vertebrae misalignment, disc herniation, and long-term nerve compression. For seniors, nerve recovery is slow and may never fully heal. This can result in reduced motor control, leg weakness, and an increased risk of falls. Safety tips for seniors wanting to stretch. Avoid bending too deeply if you have lower back issues, sciatica or loss of sensation in your legs. Replace with gentler stretches, such as stretching one leg on a chair and bending the upper body slightly forward while keeping the back straight. Always warm up properly before stretching and stay within comfortable limits. Don't force your body forward. If you experience numbness, pain, or pins and needles after stretching, stop immediately and consult with a doctor. Toe touches may seem like a familiar, easy movement, but they aren't necessarily safe for all ages. For seniors, caution with every move is key to maintaining health and preventing injury. Guridrawakan, high-impact aerobics and jumping movements. When fitness turns harmful for seniors, jumping in place jumping jacks and high-intensity aerobics exercises have long been touted as excellent ways to improve cardiovascular health and maintain physical fitness. However, for individuals over 60, these movements are not just exercise. They carry significant risks of injury and nerve damage. Strong impact forces place pressure on the feet, knees, and spine. Each jump, even light ones performed in place, generates significant recoil forces on the feet and knees. In seniors, as bone density decreases, cartilage wears down, and the body's elasticity diminishes. These forces are not absorbed as efficiently as before. Instead, they are transmitted directly to the joints and nerves. The spine, especially the lumbar region, also experiences compressive pressure with each landing. This can increase the risk of degeneration, disc herniation, and nerve compression, especially if exercises are performed on hard surfaces or without proper footwear, exacerbating foot numbness and peripheral nerve damage. One of the most subtle but dangerous consequences of high-impact exercises is the gradual wear on the nerves, particularly in individuals already suffering from peripheral neuropathy, commonly seen in those with diabetes or long-standing circulatory problems. The tingling pins and needle sensation in the soles of the feet after exercise may not just be muscle fatigue, but rather a sign of progressing nerve damage. Overexerting or practicing poor technique can make this situation worse, leading to diminished sensation in the feet, loss of reflexes while walking, and even an increased risk of falling due to balance issues. Safety recommendations for seniors. Avoid high-impact exercises like jumping jacks, jump rope, or high knee running. Substitute with low-impact activities that are still effective, such as walking on soft surfaces, swimming, light cycling, or Tai Chi. Always wear well-cushioned shoes, exercise on soft surfaces, and warm up thoroughly before starting. If you feel foot numbness, foot pain, or poor balance after exercise, stop and consult a healthcare professional. Exercise is beneficial, but for seniors, choosing the right types of activities and the right intensity is key to gaining long-term benefits. Don't let familiar movements inadvertently make you weaker. Shakinoram. Walrus yoga standing. Poses on one leg, beautiful, calm. But risky for those over 60, yoga is often praised as a gentle, calming activity with great benefits for seniors. However, not all yoga poses are suitable for aging bodies. In particular, standing on one leg poses like tree pose, warrior the third, or other balance variations can pose significant risks to the foot's nervous system and overall safety during movement. Pressure on the small nerves in the foot and ankle. When standing on one leg, all body weight is shifted onto one foot and ankle, which contains a highly sensitive and vulnerable peripheral nervous system, especially in seniors with circulation issues or conditions like diabetes. Even light continuous pressure can compress the small nerves, causing tingling, numbness, or weakness in the muscles. New practitioners or those with weakened bodies may not notice this immediately, but after a few days, they may experience a slight tingling or feel like they're walking on cotton until the condition worsens. Numbness and loss of sensation in the feet increases the risk of serious falls. When sensory nerves in the feet are affected, the ability to sense pressure, movement, and balance diminishes. Standing on one leg for extended periods, especially with eyes closed or without stable support, can make it easy to lose balance without reflexes kicking in. There have been numerous cases of seniors falling and fracturing their femur or suffering mild brain injuries while practicing yoga at home alone due to unnoticed foot numbness. Don't let stillness become a movement hazard. Many people choose yoga because they believe it is the gentlest way to improve their health. But in reality, yoga also needs to be personalized for seniors. Not everyone has the flexibility or reflexes to safely maintain balance while standing on one leg, even for a few seconds. Safety tips for seniors enjoying yoga. Avoid or reduce time spent in one-legged standing poses, especially when no instructor is present. Always practice yoga near a wall or use a chair for support to ensure safety. Switch to seated lying or kneeling poses to improve balance without putting pressure on the feet. If you feel foot numbness after practicing, stop and consult a physical therapist or neurologist. Yoga is great, but for those over 60, safety should always be the top priority. Practicing with the right posture and within limits will help keep your body healthy without the risk of falls. Walking for long periods on hard surfaces. A good exercise, but potentially harmful for seniors. Walking is one of the gentlest and most effective exercises for seniors. However, health experts warn that walking for long periods on hard surfaces with improper shoes can pose hidden dangers if certain key factors are not considered. Why walking on hard surfaces for long periods can be harmful. When walking on hard surfaces like concrete or tiles, each step generates a large impact force on the joints, tendons, and ligaments, especially in the knees, hips, and spine. The lack of cushioning from the hard surface means the body absorbs more negative effects, leaving insufficient time for recovery and increasing the risk of injury. Furthermore, ill-fitting shoes, whether too tight, too loose, or lacking proper support, can leave joints unprotected, increasing the likelihood of foot pain, knee fatigue, and back pain, while also hindering blood circulation. Risks of numbness and mild discomfort. Signs to watch for numbness. Discomfort or a heavy feeling in the feet are signs that should not be ignored when walking for long periods on hard surfaces. Many seniors may dismiss these symptoms as normal after a long walk. However, if left unaddressed or not adjusted in time, this issue can lead to more serious problems, such as impaired circulation, nerve compression, or back pain. Foot numbness or muscle weakness can also be a sign of more severe issues, like anemia, neurological conditions, or even kidney problems. Walking with improper shoes, long-term consequences. Shoes without cushioning or that don't fit properly can put pressure on the muscles, nerves, and joints in the legs. When walking for long periods without adequate support, these parts of the body are continuously compressed, leading to a reduced ability to sense movement in the legs, which increases the risk of falling. In fact, foot pain or knee fatigue is not always just a temporary symptom. If attention isn't paid to these signs and walking habits or shoes aren't adjusted, these issues could become long-term risks that affect a senior's mobility and balance. Safety tips for seniors. When walking, choose walking shoes with good cushioning and support for the joints, which helps reduce shock when stepping on hard surfaces. Walk on softer surfaces like grass, dirt, or carpets instead of concrete or tiles. Listen to your body. If you feel foot numbness or discomfort after walking, take a break and immediately change your exercise routine. Walk regularly, but don't overdo it. Gradually increase the duration and intensity of your walk so your body can adjust and recover. Walking is a fantastic activity to improve cardiovascular health and maintain flexibility. However, seniors need to pay extra attention to safety factors like shoes and body awareness to avoid risks and maintain long-term health. To protect your health and mobility, especially in older adults, choosing the right exercises and maintaining a safe workout routine is crucial. Exercises that seem simple and beneficial can sometimes cause unforeseen harm, from nerve compression to reduced balance, which increases the risk of falls. Always listen to your body and consult with healthcare professionals before starting any exercise program to ensure long-term health and safety. If you find this information helpful and want to continue receiving tips and advice on health and a healthy lifestyle, don't forget to subscribe to our channel and click the notification bell so you never miss a video. Wishing you good health and happiness.